Hello everyone, this is Vikya. We are here to discuss about cancer, which is not limited to distant places and now has entered to our families. To have a short overview and discuss about its various aspects, we have amongst us a very eminent radiation oncologist, Dr. Ashu Abhishek. Dr. Ashu Abhishek has done his post-graduation MD radiotherapy from Maulana Azad Medical College. He is member of many national and international radiation oncology associations. He has done his training and fellowships from reputed institutes in Canada, Denmark, and USA. He has got vast experience in oncology at various reputed NCR hospitals and presently taking care of Radiation Oncology Department at Fortis Memorial Research Institute, Gurgaon. And not to forget, he himself is an icon of fitness, an avid ultra runner with many marathons and under his belt, one of the monumental runs being 200 plus kilometers Pink Purple Run from Gurgaon to Jaipur for cancer awareness. Welcome, Dr. Ashu.
Thank you.
To start with, we'll ask you a very commonly asked question which is on the general public's mind, sir, that is cancer infectious? Is it contagious? क्या ये एक इंसान से दूसरे इंसान को फैलता है?
It's a very good question, Vikya, because most of the people who come to us generally think that all diseases are infectious. कोई bacteria, कोई virus cause करता है. But we need to understand cancer is not a cell which has come from outside. Actually, it's our own cell. Because in our body, every cell is destined to do some special work, grow to a certain limit. But the moment this regulation is off, the cells start to behave erratically. वो ज़रूरत से ज़्यादा बढ़ने लगती है, and then it spreads to the other parts of the body. And that is when the growth causes it to be a life-threatening disease. And that's how cancer के बारे में इतना डर है कि because once it starts growing, it's very difficult to control. And secondly, it doesn't in common spread from one person to other. छुआछूत की बीमारी नहीं है, but हाँ अंदर एक इंसान के अंदर वो बहुत तेज़ी से फैलती है.
सर, अब दूसरे क्वेश्चन की तरफ बढ़ते हैं. इसमें हमारी जनरल पब्लिक ये जानना चाहती है कि कि रिस्क क्या होता है कैंसर का. व्हाट आर द कॉमन रिस्क्स ऑफ कैंसर?
See, in general, when we were studying, I think 15-20 years earlier, that time we thought and we were taught that cancer will happen only to a older person, more than 45 to 50 years. But now with the changing environment, we are seeing young patients. They were described pediatric tumors जो बच्चों में होते थे, but now even adult tumors are happening at much earlier age. Even जो बीमारियां पहले 40-45 में described थी, we get as early as 20-25 young people having. So there's a lot to do with the environmental factors. Ultimately, we need to understand the base is always genes. So ultimately, it's a dysregulation of your genetic thing which causes cancers to happen. But then there are many risk factors, smoking being one, pollution being one. There are so many other chemicals which cause that. कुछ females में, for example, obesity may be one of the risk factors. Not breastfeeding a child can be one of the risk factors for breast cancers. So every cancer has a specific risk factor. Although I'll say that these risk factors are not directly associated because you might be predisposed to a cancer, but if not exposed to that risk factor, maybe वो cancer शायद 30-40 साल के बाद है when you are not surviving. But having these risk factors bring the cancer to come on much early and with a more advanced stage.
Okay.